As many as 9 in 10 adults with chronic kidney disease don't know they have it. If left untreated, chronic kidney disease can progress to kidney failure and early cardiovascular disease. And when the kidneys stop working, dialysis or kidney transplant is needed for survival according to the CDC. So in this video, I'm going to show you 10 warning signs that your kidneys are toxic. I'm also going to show you what's causing your kidney problems and the top foods you need to eat in order to fix it. And pay close attention to superfood number 2, it might surprise you. But first, let me give you some context that's really important to understand all of this. Why should you care about keeping your kidneys healthy? For starters, it acts as a complex filter for your blood. It gets rid of toxins and helps reabsorb important nutrients, vitamins, and minerals. In short, your kidneys play a critical role in keeping you healthy. So when you lose this extremely complex filtering mechanism, your body will start getting rid of the nutrients it needs. At the same time, you start holding waste products. It starts backing up this delicate system, and that's a problem. So here are 10 warning signs that your kidneys are toxic. Number 1, general fatigue and weakness. Most people think of chronic fatigue as a normal part of aging. It's not. Unless you're a professional athlete training for hours every day, or you work a physically demanding job like construction, it's absolutely not normal to feel exhausted and generally feel like crap all the time. General fatigue and weakness is a giant red flag that your body isn't functioning properly. It's time to do some digging. When it comes to your kidney, the mechanism of what makes you tired is urea, a waste product of protein. Too much urea in the blood is going to result in general fatigue and weakness because your body isn't functioning optimally. Speaking of urea, the next warning sign is uremic frost. Uremic frost is often seen in patients with severe kidney disease. When things start backing up in your system, it starts to manifest itself through the skin. The frost consists of a white or yellowish coating of urea crystals on the beard area and other parts of the face, neck, and on the trunk according to the NIH. The next warning sign is a metallic taste in your mouth. A buildup of waste in the blood, again called uremia, can make food taste different and even cause bad breath. People close to you might tell you you have fish breath or your breath smells like urine. Uremia can also cause nausea and vomiting. Toxins accumulating in your system could also manifest itself as itchiness in your body, especially if it's without a noticeable rash. Decreased kidney function can lead to sodium retention, causing swelling in your feet and ankles, also known as edema. It's a type of swelling where if you press your finger on your lower leg, it leaves a dent. Puffy eyes is another warning sign. The puffiness around your eyes can be due to the fact that your kidneys are leaking a large amount of protein in the urine, rather than keeping it in the body. Another common sign is high blood pressure. Modern medicine likes to treat the body as separate entities, but it's not. Everything is connected. Remember that. If this complex filter is damaged, it's going to inhibit blood flow to the kidney. The body compensates for this by increasing blood pressure. The problem with high blood pressure is it's going to start to damage the kidneys even more. It's a vicious cycle. The next warning sign is changes in your urine starting with foamy urine. Excessive bubbles in your urine means there's protein leaking in your urine. The foam actually looks like the foam you see when making scrambled eggs. And it makes sense. The common protein found in urine, albumin, is the same protein found in eggs. Another warning sign is blood in your urine. Healthy functioning kidneys keep blood cells in the body when filtering waste from the blood to create urine. But when the kidneys filters have been damaged, those blood cells can start to leak out into the urine, hence the blood. Frequent urination is another warning sign. If you feel the need to pee more often, especially at night, that can be a sign that your kidneys have become toxic. Frequent urination is also a warning sign for diabetes. More on this in just a second. Number 8, low vitamin D. Without good kidney function, you're not going to be able to efficiently change vitamin D into its active form, resulting in vitamin D deficiency. Combine that with the fact that in the US alone, 42% of adults are already deficient, while 50% of children aged between 1 and 5 and 70% of children aged between 6 and 11 have low vitamin D stores. Vitamin D deficiency can then cause fatigue, back pain, hair loss, poor wound healing, and symptoms of depression. The next sign that your liver is toxic is muscle cramping. Electrolyte imbalances can result from damaged kidney. For example, low calcium levels and poorly controlled phosphorus can cause muscle cramps. It's absolutely not normal to get muscle cramps doing house chores. Now that you know some of the warning signs, let's talk about the root cause of kidney damage. By far, the number one cause is diabetes. According to the CDC, each kidney is made up of millions of tiny filters called nephrons. Over time, high blood sugar from diabetes can damage blood vessels in the kidneys as well as nephrons, so they don't work as well as they should. It gets worse. The kidney is one of 4 main body tissues that gets damaged with high blood sugar. Diabetes also damages large and small blood vessels, which can lead to heart attack and stroke. It also affects nerves in the brain, which is why Alzheimer's is often referred to as type 3 diabetes. Diabetes also affects the eyes. Diabetic retinopathy, the most common form of diabetic eye disease, is the leading cause of blindness in adults aged 20 to 74. The scary part? Approximately 98 million American adults, more than 1 in 3, have pre-diabetes. And over 50% of Americans have pre-diabetes or full-blown diabetes. The second cause of kidney damage is high blood pressure, which a lot of times is caused by diabetes. Again, everything is connected and it turns into a vicious cycle. Diabetes causes damage by scarring the kidneys, which in turn leads to salt and water retention, which in turn raises blood pressure. Over time, diabetes damages the small blood vessels, causing the walls of the blood vessels to stiffen and function improperly. Those changes contribute to high blood pressure. The relationship also goes the other way. According to this NIH study, patients with hypertension often exhibit insulin resistance and are at greater risk of diabetes developing than are normotensive individuals. The major cause of morbidity and mortality in diabetes is cardiovascular disease, which is exacerbated by hypertension. The scary part? Nearly half of American adults have hypertension according to the CDC. It's a vicious negative feedback loop. In short, the majority of kidney problems come from high blood sugar. Now, what's the fastest way to put diabetes in remission? Severely limit your intake of ultra-processed food, live an active lifestyle, and go on a low-carb diet made up of whole foods. The best low-carb foods to prevent kidney damage are things like low-oxalate leafy greens like arugula and bok choy, as well as cruciferous vegetables like broccoli sprouts, and cauliflower because they contain an antioxidant called sulforaphane. Asparagus is also great for kidney health because it also helps detoxify uric acid. Ginger and allium vegetables like garlic and onions are also great. Next up are animals and animal products because they contain high-quality protein as well as the most bioavailable nutrients your body needs to function optimally. Things like pasture-raised chicken and eggs, high-quality dairy, as well as wild-caught fish and other seafood because of their anti-inflammatory omega-3s. As always, quality matters. Try to buy organic fruits and vegetables as well as pasture-raised animals. Avoid consuming foods with pesticides and herbicides. They're known obesogens because they act as antibiotics. Speaking of antibiotics, both prescription and over-the-counter medications like ibuprofen and other NSAIDs are filtered by the kidneys. This means that your kidneys degrade and remove medications from the body. When your kidneys aren't working properly, medications can build up and cause you harm, according to the National Kidney Foundation. That's why it's important to get your kidneys checked and to work with your doctor to make any adjustments to your medication regimen. Now, it goes without saying that refined carbs like bread and crackers, deep-fried food like French fries, and processed sugar like soda are all damaging to the kidney. But you also want to avoid certain healthy vegetables if you have kidney damage. I'm talking specifically about foods high in oxalates. They could potentially cause more harm than good. Over-consuming high oxalate foods can actually lead to kidney stones. You want to avoid things like spinach, Brussels sprouts, almonds, kiwi, beets, soy products, as well as beans and grains, especially if you're already experiencing some of the signs I mentioned in this video. As always, real food and a healthy lifestyle is the answer. Now, if you enjoyed this video, then you don't want to ignore this one. I'll see you there.